Hello, it's been a little minute, hasn't it, since I last spoke to you? I think it was the Christmas before last that I was doing the vaginal estrogen and lubricants posts. But now I actually have some more stuff to tell you about, so I thought it was worthwhile jumping back on to just tell you a little bit more about what's going on with me at the moment. The last couple of years have been essentially pretty good. I have had my ups and downs for sure about trying to work out what's the right kind of treatment to manage my menopausal symptoms, which came back with an absolute vengeance after I stopped MHT. So, if you go back through earlier editions of my vlog posts, you'll hear all about the things that I was trying, like antidepressants and gabapentin and things like that to manage flushes. So I'm at a point now, it's a couple of years now, almost exactly 2 years since I got my breast cancer diagnosis. And if you recall way back when I was first starting to talk to you, I went into hospital, and so I had a very early staged right-sided cancer, and in fact it was actually like a scattering of small cancers that were partially invasive. There was some what we call DCIS, and there was some invasive lobular cancer, but they were all confined to the breast, very early stage, not too aggressive, and luckily not spread to the lymph nodes. So at that time, I had a procedure where they did a nipple and skin sparing mastectomy on the right hand side, and where they took out the breast tissue, they put an implant in on the right hand side. And at the time, that was a great solution. It was sort of really quick to get everything out of the breast cancer tissue and breast tissue on that side. And I guess I kind of thought of that implant as a bit of a placeholder to see how things settled down over the next year or two before deciding what to do, long term. So fast forward now, 2 years later, things have definitely all settled down. And look, to be quite honest with you, I could definitely continue on as I am with one kind of weird misshapen looking breast with an implant in it. It doesn't bother me too much. But what has been playing on my mind more and more is about having the breast cancer potentially come back on the left-hand side, or even a new primary breast cancer on the left-hand side, because as we know, we all have a 1 in 7 at least lifetime risk of developing breast cancer. I've already had it, but that doesn't mean that I can't still have another primary cancer, and my risk is probably well higher than 1 in 7 of getting one in the left-hand side because of the fact that I've had one already on the right. That shows that the conditions are there for me to get another one potentially. So whether it be a recurrence, whether it be a new primary incidence of breast cancer, I have my concerns about the possibility of developing breast cancer on the left, and I've decided that I'd like to have a mastectomy on the left side as well. So that led me to think about, okay, what are the opportunities here in terms of, reconstruction, getting the chest balanced up so that the breasts look somewhat more normal and feel more normal and natural to me. I've got to tell you, the implant feels very, very cold here in Canberra on a cold morning. It does not feel like a warm part of me at all. So, it would be really nice to have something that felt and acted more like my own tissue naturally. So that's led me down the path of investigating different types of reconstructions, and I've landed on the doorstep of what's called a DIEP flap reconstruction. Now, I won't go into sort of the really medical details. I will actually put a link in the show notes underneath this video, which is a bit more explanatory about what a DIEP is. But essentially what you need to know is that they're going to draw up some tissue from my tummy and put it in my chest wall and connect the blood vessels from that tummy fat tissue to have living tissue underneath my skin of my chest wall and create some new breasts. So they will take out, it involves actually two surgeons. So we've got a breast surgeon. She's going to do the actual mastectomy part, so she'll shell out all the breast tissue on the left-hand side, and that's when the plastic surgeon comes along and he will harvest the fatty tissue and soft tissues from down in the tummy area, complete with blood vessels, and then he'll bring them up, pop them into the pockets on the chest where the breast tissue was removed, and connect up the blood vessels so that they've got an independent blood supply. And then they have to watch really, really carefully for like about 6 nights. I have to be in hospital for a week, and apparently in the first 36 hours they're going to be checking me every hour to make sure that there's no blood clots going on inside that graft, because they don't want to lose the graft. So it's going to be pretty intense there. It's a big procedure. It's like, probably minimum 8-hour procedure, and I do not know how these surgeons cope with such long days on their feet doing this stuff, but I just thank goodness that they do for people like me. So there you have it. That's a little bit of a rough intro of what's coming up for me. As I'm talking to you, it's the 17th of June, and in 1 week's time, I'm going to be in the Chris O'Brien Lifehouse in Sydney in my pre-admission clinic all day, and then in the evening of the 24th, they're going to admit me to the ward, and then very first thing in the morning, they're going to be wheeling me up to surgery and to spend the day completely knocked out on the surgical table, having my DIEP reconstruction. So I'll talk to you a little bit more as I go along about the background to that, what I'm planning and expecting. They've given me heaps and heaps of information, absolutely amazing staff that are working for this surgeon and working for the Chris O'Brien Lifehouse. They are so supportive, so thorough, and everything is so well organised. I can't begin to tell you how impressed I am. So I'm feeling very confident in them, even though it's very nerve-wracking to have such major surgery. I'm going to be pretty much offline for a couple of weeks, not able to do very much at all, and then I'll probably be able to ease back into my work without doing anything too physical, but definitely no lifting for like 4 to 6 weeks, not even any driving for at least 3 weeks. So yeah, I'll be in hospital having that procedure on the 25th of June, and I'm going to report to you a few more times before then about the build-up, and then I'll be reporting to you from hospital, so stay tuned for that.